These videos from the past of children with whooping cough show just how serious the infection can be. Already, 2 children in Louisiana have died this year. 368 cases are reported. The average is only 77 a year. LSU Health infectious disease specialist Dr. Fred Lopez says this is the worst outbreak in the state in 35 years, and there's a vaccine to prevent this.
I think there's been a lot of misinformation about vaccines in general, and I think it's spilled over to vaccines that we've had available for decades that are safe and quite effective.
It starts off with cold symptoms about a week after exposure. Then there are coughing fits, gasping for air. They're debilitating. Ribs can fracture, vomiting, passing out, and convulsions. Complications include brain inflammation and possibly permanent damage, seizures, pneumonia, and death. Dr. Corey Hebert says the vaccine, which first came out in 1914, has been updated several times and is proven safe. You're a pediatrician, and when parents come in with newborns and young children and say, I don't want the vaccine, what are their reasons?
They just say that they're scared that something bad's going to happen. So don't think that you can watch a Facebook video from anyone and think you can kind of come in and become a scientist or a physician that gives vaccines because you know enough.
Here's the recommended vaccine schedule for full immunity of children and adults. One at 2, 4, and 6 months. The next one at 15 months. The next one at 4 years, and then a booster at 11 years. Adults need a booster every 10 years, and every woman, they say, in the 3rd trimester of pregnancy needs to get one to pass on immunity to very vulnerable infants. It cannot give you whooping cough. Do older people need to be boosted from their childhood vaccine?
Yes, especially if you're a healthy adult and you're going to be around young kids, you definitely need it, especially people that are going to be around newborns.
Your updated immunity later in life could be life-saving for one just starting out in life. Meg Farris, WWL, Louisiana.